we want.
Yeah,
Okay,
I see it now.
we're recording. Okay, great. Well, welcome everybody to the Evaluations and Eligibility webinar. And tonight we are going to go over the process for qualifying for special education. Tonight it is a webinar being presented by myself, Samantha Thomas, and Amy Wall. And we're going to get started here.
Yes, welcome.
Yeah, if we're as we move forward, we'll go through some of the features and stuff that you guys can utilize as you're on the webinar or if you're watching a replay. But tonight we are going to cover different terminology as it relates to evaluations and eligibility, the eligibility process, as well as special considerations that parents of children with disabilities might want to think about when they're going through an eligibility process or a reevaluation process.
Yes.
Okay, so I'm going to let my partner in crime, Amy Wall, introduce herself first because she is the master in this room. So go ahead and tell the viewers about yourself.
Yes, thank you. So I've been an educational advocate for about 17 years now. Been working in this field for a while. And in 2016, I went to the School of William and Mary and received a certificate in special education law and advocacy. I taught for Fairfax County Public Schools for 7 years and then started doing this. And along the way, we've been blessed with 8 children. 5 of my children have special needs of some degree. And so I kind of know both sides, kind of all 3 sides really, from the teacher side, the parent side, as well as the advocate side. So I feel like it gives me a really good view and a really good way to understand what families walk through and how better to advocate for our kids. And so this is just really a joy to be able to share knowledge with parents and to educate parents and empower parents so that they can help to advocate better for their own children.
Great. And Amy is actually the person who introduced me to advocacy, but I'm very grateful for that. And I am Samantha Thomas, and I actually am a licensed and certified speech language pathologist who now is pretty much solely doing advocacy work. I do have experience in outpatient, inpatient, and school settings with speech language pathology, as well as a strong background working with children with language and learning disorders. I have experience with AAC, or alternative augmentative communication. And I am a mother of 3 children, and I am super excited because next week I will actually be working to extend my knowledge and education with a special education law summit down in San Antonio, Texas. So you guys, we're getting some great information and we're super excited to pass it on. Okay, so I know that we're on webinar styles, and we are going to have plenty of people watching the replay, but if you are here live on the webinar, we would love you to use the webinar chat feature to tell us who you are and why you are here. Are you a parent, an educator, a community member, and are you here to learn more about special education, set up your child for success, or get help? Feel free to drop that in the chat. And if you are joining us on the replay, make sure you go ahead and comment below in the comment features so we can see who is here. So we do have a parent joining us live with a child who has autism, and they have an upcoming IEP triennial review. This is perfect timing for you then. Great. Moving forward, if you guys are on the live webinar and have any questions, please feel free to drop the questions in the chat or utilize that chat feature. We can answer them as we go, or if we're thinking we're going to get to it, we'll wait till that slide or till the end. Okay, the first part we are going to go over this evening is knowing the lingo. And I think this is super important because, Amy, this is my slide, right?
Yes.
Okay, I just want to make sure. um, wait, so it is super important because we want to make sure that as we're going through this, that we are empowering you as parents or guardians or educators to understand that the language used within the special education community can be very different. It can be foreign, but the different acronyms and words mean different things. So basically, the takeaway that we want you to get from this today is not all meetings for special education are IEPs. So what we are specifically going to be talking about this evening is an evaluation meeting or a referral for evaluation meeting and an eligibility meeting, which are all part of the special education process and may or may not occur, every 3 years with your child's IEP process itself there. So the language that we really want you to be aware of is kind of going through a lot of times the step one of the entire initiation of the special education process for a child who has not been identified with a disability in the schools yet is a screening or an intervention. It's not a required part, but many of our local education agencies, LEAs, utilize that to work with the team, work with the teachers to utilize interventions first before identifying a student with a disability. The next part of that process is a referral for evaluation. The referral for evaluation can be done by the parents. It can be done by a teacher who might suspect a disability in the schools. It could even actually, I believe, be requested by a provider or a friend. Am I correct in that, Amy?
You are correct.
So
Someone who has knowledge of the child.
Yeah. With that referral for evaluation, the local education agency or your school will need to respond to that referral in some form. Okay, and that is either going to be that they are going to refer you back to an intervention process. And they're going to have to write a prior written notice to let you know that they're declining a referral for evaluation at this time. They might meet to discuss what the referral is for and go over what kinds of things are going on in the student's educational environment. Are they struggling academically? Are they struggling with behaviors, social interactions, communication, lots of different areas, and then have a team kind of decide, is it time to move forward to go through the eligibility process and or refer back to intervention and monitoring. The next step would be the evaluations themselves. And if the referral for evaluation, if they decide to go forward with seeing if a child is eligible for special education, we're going to go through evaluations and we're going to get into the nitty-gritty of that tonight. Okay, so get ready to take some notes. Amy has lots of great details on what that might look like. And again, this is just kind of a rough overview of the process and the language that we're going to be using. Following those evaluations, you're going to have the eligibility or the eligibility meeting to review evaluations and determine if a child is a student with a disability in the educational setting, and if that disability impacts them adversely within the educational environment. And then if the team decides yes to that, you will move into the individual education plan or the IEP, which we often use for lots of different meetings. It can be the document, it can be the IEP meeting, and a lot of people will refer to eligibility as IEP, but we wanted to make sure to distinguish that language for you all. That way, if you are going in and requesting that your child be evaluated for special education, you understand you don't just go in and ask for an IEP, you ask for an evaluation to determine if they're eligible first. Okay, so hopefully that's clear as mud, and we're going to move forward and hopefully get more clear on all these pieces. Okay, so this next part is really looking at what is eligibility and this language, and we want you to understand what this language means. And eligibility is the process of determining if the student is a child with a disability and whether there is an educational need for an IEP, individualized education plan, or a 504 plan. What is needed for eligibility? The referral for evaluation, just like we talked about, relevant assessments completed, and then adverse educational impact. As somebody in the chat mentioned here, a student must be found eligible again for special education at least every 3 years. That's often referred to as a triennial review, but it can happen sooner if the team or somebody on that team requests it and decides that it is appropriate. Okay, I'm going to pass the ball to Amy here to discuss the difference between the educational and medical disability models.
Yes. So this is something that can often confuse parents, especially if you have received a diagnosis from a doctor, or if you have seen a psychologist or a neuropsychologist and received psychological or educational testing from them, because they are looking at that child from a medical model. And so they will make recommendations that often the school will then turn around and deny. And so we wanted to take just a little bit of time to kind of explain to you the difference between educational model versus medical model, because it is really important as this team start to look at how the disability or the areas of delay impact your child. So the medical model is a disability or diagnosis made by a medical or health professional. These things are things that can affect a child in all areas of their life. And so they're things that may be physical, they may be a health issue, they may be emotionally driven, or even psychologically driven, but they're looking at it from a whole child and the whole life experience. So if you have a medical diagnosis, you can have zero educational impact. And that is what is important, because the educational team wants to look at how do the disabilities and the areas of delay affect the child in the educational setting. So the educational team is going to look at a disability and determined by a group of educational professionals. So they're going to be looking at how does that disability affect a child in that educational setting. So it might be that a child's speech, maybe they are disfluent or they have a stutter. But if they're in a school setting and they're able to be understood by their peers, understood by their teacher, and communicate their wants and needs within the school setting and make educational progress, there is a likelihood that the educational team might not find that child eligible for speech services within the school setting because they are able to meet their educational goals. So you can have a medical diagnosis and not have educational impact, and the educational team will not recognize that or do anything to help the child within the classroom because they don't need it. You can also have educational disability without a medical diagnosis. So say you have a child who is struggling with social skills and struggling with communication skills within the classroom, does not have a diagnosis of autism medically, but the school system can find that child educationally in need of an autism label because they exhibit many signs of autism within the school system. So those are just a couple of examples of what can happen, but we want you to understand that if you walk in with a medical diagnosis, it does not guarantee that your child will receive educational assistance within the school system. We also want you to understand that the educational team, while they cannot diagnose a condition, they can find educational impact within the school system and use an educational label. And the educational labels are what we're going to talk about a little later. So I'm going to pass it back to Sam.
Yep, and I'm going to actually stop sharing my screen really quick because I just want to make sure that it is the best sharing quality that we have here. So give me just a second, guys. And go here. because it definitely looks different. Oh, okay. Well, I guess we're just going to go with it.
Technical issues.
Technical difficulties. Here we go. Okay. We're back. Okay. So moving forward, we are going to now talk about the different educational disabilities, or the 14 categories that are defined by IDEA, or the Individuals with Disabilities Act. And this is a federal level. So these disabilities really do not vary from state to state. So if you're joining us from a state other than Virginia, these should be ones that you also see within your state. And they include autism, deafblindness, deafness, developmental delay, which is often only available until 7, at least in the, sorry, may I see that? At least in Virginia. We have, I can't get my video back. I'll have to play with it next.
No, you're back on. You're back on. We see
okay.
you. Yeah.
Okay, great. And then emotional disturbance, hearing impairment, intellectual disability, multiple disabilities, orthopedic impairment, other health impairment, specific learning disability, speech or language impairment, traumatic brain injury, and visual impairment, including blindness.
And Sam, would you quickly just kind of touch on how speech and language impairment can stand both as a single eligibility criteria, or if they have another eligibility criteria, it is then considered part of the related services? Can you kind of explain a little bit about that real quick?
Yeah, I think that's a really great question. So speech and language impairment can function as a standalone disability, or speech and language can be put on the IEP as a related service. So if speech is offered as a related service, it often means that that speech or communication or language impairment is a manifestation or due to whatever your child's primary disability is. If you have speech and language impairment as a primary or even a secondary or tertiary disability, that means that the team has determined that that is a separate issue or entity from their other disability categories. So if anybody has questions on that, I know that can be a little confusing, and actually that's the only related service area that can be a standalone or a related service.
Yes, so occupational therapy and physical therapy cannot stand alone, but speech impairment can. Jackie's asking, can you not have an SLD, which is the code for specific learning disability, if you have others? So I think we are going to touch on that a little later, but the answer to your question is that is a complicated answer. You can have multiple different categories. There are certain categories that you cannot pair together. And so we will discuss that as we get down into, we're going to go through some of the operational criterion worksheets, or the OCWs, in a few minutes.
Okay.
Okay, so you have made the request for your child to be tested for special education. They've set a meeting date, and you show up at the time, and they escort you to a room and open the door, and there is a whole mob of people inside. It is by far one of the most intimidating feelings as a parent. I mean, being a teacher myself and an advocate, you think I would have been prepared, but the first time I had to do it, it was just overwhelming. It felt like me against the school system. And so we want to break it down as to why there are so many people in the room, and what their role is. So there are requirements by the law for specific people to be a part of the team. And then there are extra people sometimes that you bring in depending on what your child's needs are and what your concerns for them are, or what the whoever made the referral to the team for your child, whether it be your teacher or someone else. So your child's teacher is always going to be in the room. They're going to be the expert about your child in the educational setting because they're the ones who spend the most time with them during the day. They're going to be able to talk about their strengths, their weaknesses, what kinds of things they have, the teacher themselves has put into place to try to help your child keep up with the curriculum, or what they've put into place to try to help your child with any kind of behaviors that might be going on. And they're going to be able to kind of explain what they see in their setting. There's always a general education teacher in the room. That's usually going to be your child's teacher if this is initial evaluation. If it is one of those triennial evaluations that Sam was talking about, where we review their progress every 3 years, your child's assigned special education teacher will also likely be in the room. If it is the initial evaluation, they have to have a special education teacher in the room, but it might not be a teacher with knowledge about your child. She is there because she is going to be part of the testing process, or he may be there as part of that team to help make determinations. There are also going to be, some teams use special education teachers to do the educational evaluations and tests that we'll talk about. Some teams use what we call an educational diagnostician. That is a teacher who is specialized in training and usually doesn't teach a classroom, but focuses only on testing children who are going through eligibility process. So you may have a diagnostician in the room, you may just have special ed teachers. It depends on the team. And usually in Prince William County, at least, at the elementary level, it tends to be special ed teachers. When we move to middle and high school, you end up with those educational diagnosticians in the room just because the schools are bigger. A psychologist is typically the lead on the team. They are the ones who normally will run the meeting, who have the most information about the process and kind of can answer extra questions from you. They're also the ones who are going to do psychological testing, including intelligence testing or IQ scores. They're going to do processing tests to kind of determine, does your child have difficulty with processing skills auditorily or visually? They're going to look at the memory. They sometimes will look at behavior. Sometimes that's done by another person. So they may send some checklists home for you to fill out about what you see your child doing in the home setting. And they also will do some observations within your child's classroom to kind of see how they react and what they're doing and how well they're able to participate in their environment. We also have therapists. Almost always the speech therapist is a part of that team for every child. If there's an additional issue with motor skills, then an occupational therapist or a physical therapist may be brought in. So if it's important to you that your child have occupational therapy or physical therapy evaluations and look at those skills, it's really important that you communicate that to the team up front so that they can have one of those therapists join, because they don't always come. There will always be an administrator, it's required. So either a principal, an assistant principal, or sometimes the schools will send what they call the chairperson of special ed or the special ed lead. And occasionally, you can also end up with someone from the Department of Special Ed within your county that will come. So that's typically more often if there's a really contentious case, or if you bring an advocate into the room. Then other people might be a guidance counselor. Social workers are always involved. They're going to collect information about your child's background, kind of how things develop through their childhood, through their babyhood, depending on how old your child is. They're going to talk about any kind of medications they might be on, what your home environment is like, and you can share as much or as little as you would like with that team.
Amy, I'm going to jump in here really quick and just make a quick note that the only time that you likely won't have a psychologist or a social worker in the room, especially for maybe an initial eligibility process or referral process, is if the only concern is speech and language. So again, that's kind of one of those unique pieces. So if we have anybody on here tonight where you have a child who is having challenges with their speech sounds or language or, a stutter, you may not see all these people in the room. Then it will be an admin, a general education teacher, and a special education or a speech language pathologist. So just to kind of be clear that way, if you are like, why is nobody there? If your child is a speech kiddo, then you'll understand that.
Yeah, that is true. So what are they going to do? All these people are there at the meeting. What are they going to do? They're going to talk about your child. They're going to talk about strengths. They're going to talk about weaknesses. They're going to talk about areas of concern. And then they're going to determine what kind of testing that they're going to do. If it's a speech language only child, obviously the only testing that they would do would be speech testing. All of the other areas, they're generally going to request, especially for an initial evaluation, a psychological, an educational, meaning the psychologist is going to test, the educator or the diagnostician is going to test. They usually will at least do what we call speech indicators, where teachers will check off what their concerns are and what the child can do in the classroom. If there's absolutely no speech concerns whatsoever, they won't do that. But if there are concerns, they will either do a speech indicator, or if the concerns are severe enough, they will just ask for an evaluation up front, as well as OT and PT. If you have occupational physical therapy concerns. And then the social worker is going to call and set up either a meeting over the phone, over Zoom, or you to come in person to meet with that worker to just review the history of your child. And then they're going to put all of that information into reports that you're going to get in a little while. So they will do all of this testing and evaluation during the school day. They will pull your child for a short amount of times from the classroom over several days and do little snippets of tests. They will come into the classroom, specifically the psychologist. Sometimes other people of the team will also go into the classroom or classrooms and kind of watch your child and see how they're able to access the education within the room. What kinds of things are they able to do? What kinds of worries and concerns do they have? And on occasion, if your child is struggling during the school day, I have known teams to sometimes schedule time outside of the school day, but that's very, very rare. So once you've got all of that testing done, they are going to put it together in reports. Like I said, they have 65 days to complete all of the evaluations in the state of Virginia. Other states may have different timelines. So if you're watching us from outside of Virginia, you can go to your state's website to find out what the timeline looks like and when they must complete those evaluations for you. You can also ask your county, either your principal, or you can call the county office to ask, because sometimes counties will shorten it within their county so that they can make sure that they always meet the state requirement. So I know that I believe Prince William at one time was aiming for 55 days, just because you never know when a parent's going to get sick and can't come, or we have a snow day or something else happens. So if that happens, they try to have a little bit of wiggle room. I think that is all. Oh, no, let me take a quick drink before I start coughing. All right, so what can you do while you're waiting for that during that 65-day timeline? Well, if you've got any kind of private providers that are working with your child, say a speech therapist that's privately working, or an occupational therapist, ask those therapists, have you done any testing on my child within the last year that you can share? they're only good for about a year. So if it's older than a year, it might be good historical information, like to share with the team for history purposes, but they're not going to use it for current levels if it's older than a year. But if that private therapist has testing within a year, then you can submit that to the team. And that's very helpful for a couple of reasons that I'm going to go over in a minute. You can also ask them for progress notes on any therapy that they've been doing so that the team can kind of see where your child has been, where they're going. You can also get private testing done if you don't already have it done. There is a little bit of risk to doing this at the same time, because these standardized tests that the therapists and the specialists use oftentimes cannot be given more than once in a certain amount of time, usually within 6 months or a year, depending on the test. So like there is a psychological test that's frequently used by the schools, but also frequently used by private evaluators called the WISC. It can only be given once a year. If you give it more than once a year, it loses its fidelity, and you cannot use the scores of the test. So it's very important that if you choose to get a private evaluation, that you at least share with both teams what testing the other team is planning to use. That way they don't duplicate the tests. And they can there's many tests. So if you share, then they are able to just find a different test that they can use. Or the school sometimes will let the private evaluator do their stuff first. They'll look at what was done, and then they'll determine whether or not they need to do anything additionally on top of what the private evaluator has done. So just be open with your teams if you're planning to get a private evaluation. And just because you're open with them does not mean you have to share the reports with them, although we will talk a little bit later about that. Well, actually, I guess I'll talk about it now. If you have those private reports and you're in agreement with the private reports, say, it looks like that evaluator has really done a good job of evaluating your child and you really feel like they hit the nail on the head, share that evaluation with your team at the school, because it will help them so much in making appropriate determinations. And private evaluators often use more information in their gathering of things than the school is able to do, just for time purposes. And so it is often very helpful to school teams to see private evaluations and look at the information that the private evaluator has come up with in determining both eligibility and the goals that might be needed on a child's IEP. If you don't agree with the private evaluator's determinations and you don't want to share with the school, that's okay. You're not required to share it. But I would encourage you to at least share the names of the tests that were used so that the school system can use the appropriate things for your child.
Yeah, and really, I like to also point out that if you are in agreement with those tests, particularly if they're a psychology test, psychological processing test, academic testing, or even speech and language evaluations, if they're within a year, that a lot of times that information is still relevant, and it also prevents your child from having to receive additional testing on top of what they've already been through in some cases. So they can use that existing information and just gather new stuff that helps supplement that. So again, I think that there's lots of benefits to sharing private evaluations or outside evaluations, as long as you are comfortable with what the private evaluators did find within their own assessments.
Yes. And if you've had any medical recommendations by doctors or just medical diagnoses without testing, like ADHD, oftentimes pediatricians will evaluate a child in their office and be able to determine whether or not they have ADHD, and will just write a letter or a prescription If you have that kind of documentation, also gather that up and give it to the teams. So when we talked about the medical model versus the educational model, even though they're different, it is often helpful to share any kind of letters or recommendations that doctors have made for your child with the team, even if they don't agree. It's still beneficial for you to share that information.
Okay.
All right.
Now that we have talked about all those evaluations, what happens after all those evaluations are completed? You get the reports. I think, as Amy mentioned, you're going to want access to those reports ahead of time, and you want to request those. You have 2 business days to get those ahead of time to just start reading through them. It's going to be a lot of information to process, whether you are brand new to the special education process or even somebody who has gone through several of them with either one child or multiple children. So right now we're going to talk about what goes on at the eligibility meeting, or the big day. And this is where the team should convene to review the reports and provide explanations of the assessment measures. They're going to consider educational disabilities based on the reports and assessments and the areas of concern by the general education teachers, parents, or whoever referred. And then they're going to complete something called an OCW, or an operational criteria worksheet. And this is, again, specifically used in Virginia, and other states have these worksheets or these criteria to go through built in their own way. Now, this big day can be nerve-wracking for many parents and professionals alike. After all, this is a meeting that may be the first time that you as a parent are getting the big picture of what strengths and challenges your child has. So it may lead to some heavy emotions. It may lead to fear or despair or anxiety, or maybe even relief that somebody's finally figured it out, what's going on, why your child is struggling. But knowing what to expect at this meeting can help ease some of those emotions and help you as a parent or a professional begin to look toward future solutions. So let's talk about what goes on at this meeting. We've kind of talked about they're going to review the evaluation reports, and each person is likely going to go through the report. Whether they read from the report in its entirety or summarize it really depends on the professional. This is a great time to ask questions about that report and make sure that you are able to understand what's going on. If you don't understand what's going on, then you are going to want to make sure to ask those questions or write down questions for the future, okay? And then once you guys go through all those reports, the team is going to move on to considering a disability. So if there is a suspicion of a disability after going through the reports, you are going to work as a team to decide which of those 14 disability categories are needing to be considered. No, you're not going to go through all 14 OCWs at that meeting, okay? And if you do, that's a problem, unless you have a very, very, what's the best word? Unless you have a very, very complicated child with medical background, but I don't think I've ever seen a child go through all those disability categories. And then once you choose what disability categories that the team is going to consider, you're going to go through the definition of the disability. And I'm going to go through these OCWs. I have 2 examples on this next slide here, as well as, and I'm actually just going to flip over here. They'll review the definition of the disability with you. This can also be found on VDOE. It can be found on IDEA websites to see what that means in the educational setting. And then you're going to go through evidence of that disability from the evaluation. So those evaluation reports by those school psychologists, by those speech language pathologists, are going to be extremely important in determining, is there actually an educational disability? Okay, and I know we talked about the educational advice, the medical model earlier, and what that looks like in the schools. After that, you are going to discuss as a team that this disability is not related to or due to differences or other factors that the student may have. And some other factors the team needs to consider is the impact of cultural and linguistic differences, socioeconomic factors. If a student, there's some other criteria pieces, such as when you're looking at intellectual disability, I think you have to rule out, or it might be TBI, you have to rule out another type of disability with autism. You have to rule out the emotional disability. So you are going to have to consider some of those other factors, and you may even have to rule out exposure to trauma or lack of instruction. You know, if a child hasn't been in school and hasn't been able to receive instruction, that certainly can impact whether it might just be a difference at this point in time rather than a true disability. And then the next part the team will review is the adverse impact, the adverse educational impact. And as Amy discussed earlier, to receive special education in the schools, your child is going to need to have a disability with an adverse educational impact. And the word adverse generally means to cause harm, acting against, or preventing success. And adversely affect means to negatively impact or significantly impede more than a minor hindrance. Okay, so that's really important for everybody to understand, because we have had instances where you might have a parent go in and say, well, they have this disability or they have ADHD, and it sometimes impacts them, or it's a little bit, or it may not be impacting them at all in the school day. So that adverse impact is super important to understand. And the adverse impact on educational performance is often only looked at for academics, but it can also be an adverse impact in their educational day on their social emotional skills, their functional skills, which can be daily living skills. It can be, you know, can they utilize the bathroom functionally? Can they tie their shoes? Can they get from point A to point B? Can they get through the lunch line, as well as behavioral skills? So students with passing grades might still have difficulty in the educational setting with forming social relationships or interacting with peers and adults. And again, while we often focus on the academic piece, those other components are super important to look at as well, and are often where we as advocates come in and really work with a parent and a team to make sure that those are recognized in addition. And the final piece of those OCWs is deciding if the child requires specially designed instruction, which means that they require more instruction than an individual student or a general education student requires to make the same amount of progress. And while all students may benefit from additional supports, the criteria question requires the team really to determine if specially designed instruction is required for that individual student. In the context of decision-making for special education eligibility, in the state of Virginia, specially designed instruction is defined as adapting as appropriate to the needs of an eligible child, the content, methodology, or delivery of instruction. And that can be to address the unique needs of the child that result from the child's disability, and to ensure that they can access that general education curriculum so they can meet their educational standards the same as their peers. So I know that can sometimes be confusing, and you can go through all these pieces of the OCW and say, yes, 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 yes. But sometimes the team might say, no, they don't need specially designed instruction because their general education teacher can provide that. So let's take a look, because now we've been kind of theoretically talking about these OCWs here. And I wanted to give you guys, again, these are examples from VDOE. Each county is going to look a little bit different with regards to what these OCWs look like. But it has, again, the basics, the definition. They're going to go over in brevity, usually, the definition of autism, Then step 2 is, do the evaluations demonstrate that there's impairments in social interactions, restrictive, repetitive, or stereotypical behavior patterns, patterns of behavior, interests, and activities, or impairments of communication. They also have a part where, do they have an outside medical diagnosis of atypical autism, Asperger's, or PDD, NOS? So again, just kind of seeing how that flow would go. The whole team would go check yes or no, true or false, check yes or no, true or false. And then again, there's documentation of the adverse effect on educational performance due to these characteristics. This is the section where the team should be typing in a pretty specific response as to, let's just use the example of a child with autism, how the characteristics that you've checked up here are impacting them in the educational environment. So their impairments in social interaction impact their ability to communicate with peers, or to work alongside with peers, or interact with peers and adults in the educational setting, in large group settings, in small group settings, and really defining what that looks like for each individual child should be going here, so you're not just putting in generics. And then, as I said, the final question is always that due to the identified autism, the student needs specially designed instruction. The SLD, or specific learning disability worksheet, is a little bit longer, takes into consideration some of the cognitive processing as well as academic achievement pieces. Again, the evaluation outcomes, ruling out that it's from something else other than, or that that disability is not from some other factor, adverse impact, do they need specially designed instruction? And then here, down at the bottom with the specific learning disability, again, they're talking about, was the child provided high quality instruction, research-based instruction prior to being found eligible, and really making sure that you don't just have a child who has not received quality instruction getting identified with a disability. Okay, so there's a lot of information here. Amy, is there anything that you want to add to this part before we move on?
So I just wanted to touch on kind of what Jackie had asked us earlier, in that, can you have, well, she specifically asked about specific learning disability, but I'm going to broaden it. Can you have more than one disability category? And the answer is yes, you definitely can. If you find that if the team finds that the child has characteristics of autism that adversely affect that child in the classroom, and also has specific learning disabilities, there's maybe processing issues or reading issues, math issues, then you can be found, you can qualify for both criterion.
Yeah.
OHI is often teamed with other disability areas. OHI is other health impairment. And so if your child has ADHD, but also has a learning disability, you can have SLD and OHI at the same time. And there's also even a criterion worksheet for something called multiple disabilities, where a child may carry characteristics of multiple different areas, and you have a difficult time teasing out when one overlaps the other and which one is really causing all of the difficulty. And so we will sometimes use the multiple disabilities category when we have a situation like that. So you may go through more than one criterion worksheet. Like Sam said, I've never been in a meeting where we've done all 14, but I have been in a meeting where we've done 2 or 3. I've even had one where we did 4, and it was one of those multiple disability category ones. And so just know that it may not lock down into one OCW. You may have more than one.
Yep. And that's a really good point, Amy. I did forget to put in the slide, the next slide. What happens after you go through the OCWs? You know, what does that look like? Well, the team is going to summarize what disability the student has, that adverse impact and why they need specially designed instruction. They'll often identify the areas in which they need specially designed instruction. So do they need help with math? Do they need help with reading? Do they need help with social skills? And then if you have gone through and determined that the child does meet criteria for more than one disability and require specially designed instruction under those disabilities, then you will have to put them in order from primary, secondary, tertiary. And the team again has that discussion as to what they think is the primary disability that it's impacting them most in the educational setting.
Yeah.
Okay, so after that piece, they are going to provide you with a prior written notice of what has been decided that day. They're going to provide you with that summary, and they're going to ask you to sign on that dotted line, whether you provide consent or agree with the eligibility determination or disagree with the eligibility determination. So if you agree, you guys will move on to eligibility or to IEP. Generally speaking, at least in the state of Virginia, they have 30 days to propose an IEP. But what happens if you don't agree? And I'm going to have Amy go over that next.
Yeah. And I would also like to point out that you do not have to sign, agree, or disagree on the day of the meeting. It is well within your right to take all of the documentation and go home and read over it and digest it. They just threw about 2 hours worth of information at you. And it is a lot to take in. And so if you feel overwhelmed, take all the documentation home and read over it. Go over it with people who are familiar with your child and also care about your child. Go over it with your spouse, your partner, go over it with your mom. If you've got private therapists, let them review it and see what they think. Do they agree with the assessments and everything? You are well within your rights to take a couple of days, even up to a week, to really kind of digest that information, go over it, make sure those reports that were written are correct. It is the specialists that do these reports do a lot of them. And so it's not uncommon to occasionally find misspellings of names, family members who were left off or misspelled or ages wrong. It's also not uncommon to have pronouns switched accidentally, things like that. So as you're reading through the reports before the meeting, make notes of any changes that you would like made. You're welcome to share that information with the therapist or the psychologist who wrote that information. And I have had many of them say, oops, I'm so sorry. I will change that and get you an updated copy. Just make sure you get that updated copy. But take all the information home and look over it, read over it, make sure you've digested it. And then if you agree, sign an agreement. If you don't agree, do not sign an agreement. You have things that you can do to go forward. You can write a letter of the reason why you do not agree. And in fact, this is the only time in the process that the school team can actually write a letter in disagreement. So you may have had a lot of discussion, and maybe there's a teacher that doesn't agree with the finding, or maybe there's this therapist that doesn't agree with the finding. They are well within their rights to also put a letter of disagreement with the eligibility. You can request what is called an independent educational evaluation, or we call it an IEE for short. An IEE is something that is a private evaluation that is paid for by your school district. You write a letter to the school district stating that you are in disagreement with the findings of the evaluation done on your child, and you request an independent educational evaluation. Then the county or the local education association, the LEA, has two options. They can either file due process if they strongly feel like what they did is correct and their finding is correct. Or they pay for an independent educational evaluation. I will tell you, in 17 years, I have never had an IEE request denied. It is an easy thing for them to do, and then you can come back to the table after it's done and talk some more. When you request an IEE, the LEA will provide you with a letter that states that they approve it. It states the amount up to that they will pay. So say they're going to pay up to $3,000. And then they will also provide you with a short list of providers in the area that do the evaluation. One of the reasons that they do this is because it's required by law that the evaluator that you choose have the same credentials or higher than the person at the school district who did the testing. You also may not choose another provider within the school district. So say the psychologist at your school, you didn't like the report that they did, you felt like they didn't do a good job, but you have a friend who works at the school down the street who's a psychologist. You may not pay that psychologist to do another report because they work for the county school system. So it has to be someone who is not an employee of the county school system. You do not have to choose a provider from the county's list. It is not required that you do that. You may pick whoever you want, but remember, they have to have the same credentials or higher that the therapist or specialist at the school system uses. So say the psychologist at the school has a master's degree, you need to pick a psychologist who has a master's degree or a doctorate to test your child. And they have to do similar things. So if you're in disagreement with the psychological piece, then the only piece the county is going to pay for is the psychological evaluation from an evaluator, even if they do an educational component. The other thing to this is if the county says they will only pay up to $3,000 for the evaluation, but the evaluator charges $3,500, you may pay the additional $500 out of pocket and get a full evaluation, including additional testing, and bring it back. The county just will not pay for that extra portion. So hopefully that kind of makes sense. It's a little bit confusing, but in any case where Sam and I have requested an independent educational evaluation, it has always worked to the benefit of the child to bring additional information to the table to be able to discuss. It's important that you know that the county is required to consider the private evaluation and what they have provided, but it is not a guarantee that the county is going to change their mind. So you may go through this process, you may get additional testing, you may bring it to the table, and then the school system still says, we see the results. However, we still do not find that the educational impact on your child is great enough to warrant special education services. Or they, you may be trying to get them to change a operational criterion worksheet, maybe from, say, autism to something different. They may choose to continue to stay with their decision. So it's not a guarantee that they're going to change their mind. However, in our experience, it always benefits the team to have additional information. So we do encourage parents who are in disagreement with the county to seek that IEE out just to see if additional information will help. Is there anything else on that you can add, Sam?
No, and I think always when in doubt, there's tons of resources out there. If you are not sure, there's resources through parent advocacy centers, through the VDOE, they have a parent ombudsman, which assists with advocacy. There's advocates such as Amy and myself around that are able to even go through and review pieces like this if you're just not sure, as well as, maybe asking a teacher friend or a friend who is in this to just kind of get that second set of eyes or second opinion on if you're ever just not sure that you agree with what's going on within the eligibility or evaluation results.
Yep.
Yeah. Okay, so other factors to consider when you are going through the eligibility process. Don't be afraid of the label. I have sat on both sides of the table, being a part of the member of the eligibility group as the county side or school side, as well as on the parent advocate side. And there are so many stereotypes and perceptions and misconceptions that may come with a disability label. And as a parent, it can be really scary to hear that your child has a disability. But I do want you guys to remember that the disability and that criteria is what is going to get your child special education support under IDEA. So if you agree with the disability definition, if you agree with the characteristics that were described in the evaluations, then I do encourage you to really strongly stay going along with the team and not just be afraid of the label of that disability. Yeah, go ahead.
For the label piece of it, I will add to Sam that oftentimes parents have said to me, well, my child is only 6. And it's such a big thing to put on them. And it's going to carry through the rest of their life. And I will tell you that if your child outgrows the need for special education, no one's really going to know and look back on their life to know that they were a child with a special need or with a special label. However, if your child ends up needing support throughout their life, whether it's accommodations in college, or whether your child ends up being a child with a lower intellectual functioning and ends up needing a work program or assistance there, I will tell you that it is often requested by institutions of higher learning or by programs for people who need more assistance. It is often asked, how long have they been identified? How long have they been receiving services? And it's important that you're able to share that there is a history of that, because oftentimes it helps you to get them services as they're older as well. So even though I know it's really scary to be talking about labels and things like that for kids who are really, really little, just know that it may help you in the long run as they become adults.
I agree. And then kind of leading into that, while it is true that to not be afraid of the label, we want you to also know that the educational label or the disability does not determine placement. We've often had parents come work with us and they're nervous about their child getting a diagnosis of autism in the school, or just being identified as a student with autism and being put in a self-contained autism classroom. And that might be what your child needs. It might not be. So just because they have a disability of autism does not necessarily mean that's where they're going to go. Or if you have a child with a specific learning disability, it doesn't necessarily mean that they're going to be removed from their general education classroom all day long and go to this separate space that just works on, that's just for students with disabilities. I know back in the day when we went to school, sometimes that was the case. And so it might be that there's lots of different instances in which their disability category may not match where they're placed or the program they're being serviced under. The next part for you to be aware of and informed of is the special education programs at your child's base school. This is important because if you do have a child who has more educational needs than what can be provided just solely through the general education classroom, or what we would call maybe a level 1 support where they're receiving periodic special education instruction. There may not be a program that your child requires at your base school, or there may be. So a lot of times where we see this is there's not always level 2 autism programs, or there's not always ID programs or ED programs at every single school. So it's very good for you to be informed, ask those questions about what programs are available at your child's school, and to get some more information about those. And I'm going to jump down to the last little bullet here. If you do have concerns about programs, share that with your school up front and ask them to be up front as well. If they think that they're going to consider or have a discussion regarding changes in placement that may not be available at the school you're currently at. Most of the time, they're not going to say it right out front, but they may say, hey, yes, we are going to talk about this at the next meeting, so you can kind of mentally prepare and ask some follow-up questions. And then finally, getting service through multiple programs. This is not something that is often used by schools because of continuity of case management and having continuity of a provider, and just logistics. However, that doesn't mean that it's not appropriate for your child. And it doesn't mean that it's not what your child needs. So if your child is a student, let's say with a specific learning disability, and they have needs in reading and maybe some social skills deficits, they might receive support in reading through the learning disabilities program. And then you might have an autism program at your child's school who can really help your child with the social skills part and may already have a social skills group in place. You may have a child with ADHD that needs support with work habits, and that can be serviced through an LD program as well as an autism program. So note that it is okay for multiple programs to be utilized. And if your child's school is saying that we don't have that program, you can ask what other programs might be able to have that support as well. Anything else, Amy, on this special factors?
Yes. So if your child is identified with a label and the school is considering a specific program that maybe your base school doesn't have, please know that it is within your rights to kind of talk to them and see the program at the other school that they might be looking at for your child. It may be that they require you to come after the children are gone for confidentiality reasons, and that's okay, but you could at least go see the building. You could see and meet the teacher, meet the administrators of that other school, and those sorts of things. So don't be afraid to halt the process at any point and say, I would like to see this program that you're talking about being a potential for my child. So just know that you have that ability to do that.
Okay, cool. Sorry, now I have some background. I was trying to make sure I was in on both ends. Okay, so now we are wrapping up. If you guys have any questions, this is a great point for you to drop them in the chat while we're sharing just some resources. And that way we can get to those questions at the end. But some great resources, if you've been on a webinar with us, that Amy and I almost always share, is the book From Emotions to Advocacy by Pete and Pam Wright. It is a great tool for parents and advocates and anybody working to keep those emotions in check at those meetings and really learn the best ways to do your best to look at it and work as objectively as possible and collaborate with your child's educational team. The ARC, obviously tonight, this was sponsored by the ARC Greater Prince William, and they have fantastic resources, webinars, and community outreach programs that they can share. Virginia Department of Education, if you are in Virginia, is certainly a really good place to go. And the search tool up at the top is very helpful because the site can be a little overwhelming. This evening, we used guidance documents from VDOE, such as the supplemental guidance for evaluation and eligibility. This is a PDF that can be downloaded for you guys to view. And I actually was going to try to drop that in the chat. I'll try to drop that in the chat before we leave. If not, it will hopefully be in the comments in the replay. Parent resource centers, and then understood.org is a site that Amy and I utilize a lot to also lead us to new resources, get ideas about IEPs and eligibility and pieces moving forward. And then finally, if you guys would like to get in contact with Amy and I for any reason, we are certainly available to talk. You can contact us via email at quiveradvocacy@gmail.com. That's going to go to Amy, or at sam@slpthomas.com. We talk daily. So if you guys have questions for both of us, feel free to send it on to one of us. We also both have websites you can view to learn more about our services, and then you can follow us on social media because we do share resources from time to time, as well as upcoming webinars. And then finally, we will actually be doing another event webinar next month. So if you are somebody that has a child with an IEP already or is about to get an IEP, we will be doing an IEP goal writing webinar. We have identified this as an area that many of the schools are struggling with in our area. And so we found that it is super important for parents to be educated on good IEP goals. And if you have any teacher friends or people in special education that want to join us too, it's a really great opportunity for them to go over goal writing too. And then also on my website, slpthomas.com, I do have a course called Finding Your Voice, Becoming an Empowered Parent Advocate. And that goes through basically the process of your child getting an IEP and everything you can do in between. So with that being said, that's pretty much finishing it up for this evening. Amy, do you have anything else to add with resources or connecting?
Nope. I think we've gone over it all.
Great. So I'm going to leave this time then to open up for questions in the chat. You can put them in there. We can bring you on as a panelist. Otherwise, you guys, thank you so much for joining us tonight, and we hope to see you next month. Okay, let's see here. I'm going to stop recording while we're waiting on this.